Hello, my name is Ahmed Khaleel and welcome to my presentation on Alzheimer's disease. In this presentation, I will introduce you to Mr. Diamond Smith, who is our client, two brain regions that are affected by Alzheimer's disease, four characteristics of dementia, structural and functional changes, along with one medication in the management of Alzheimer's disease. Mr. Smith is a 75-year-old male and has been diagnosed with mild Alzheimer's disease a month ago. His wife works in a nearby grocery store and they have no children. Past medical history includes type 2 diabetes, hypertension, and dyslipidemia. His father was diagnosed with Alzheimer's disease at 70. Now, Mr. Smith is a retired factory worker and an ex-smoker who used to drink socially. He was brought in to the rural area by his wife when she found him lost wandering outside home while she was returning from work. Now he has been having issues with memory and cognition, which includes spatial disorientation, and has also been finding it difficulty to form sentences and speak. He has been aggressive in the past to strangers and has been found to hallucinate. Now, his wife reports agitation has worsened and his lower back pain is there, but he is unable to verbalize. Now, she says that he is not the Diamond she knew for 50 years. His personality has changed so much. Now, he is also on cholinesterase inhibitor, and donepezil is one such medication, 5 milligram nocte for the past 1 month. Alzheimer's disease is progressive; it worsens with time, quite a few causes contributing, which is why it's called a multifactorial disease. It's a neurodegenerative disease, which means the neurons in your brain are dying. So you will find beta amyloid plaque and tau proteins in your brain, which cause neuronal death, as a result, shrunken gray matter. Now, if there is no reason that can be found for dementia, then the individual falls in the category of Alzheimer's disease, which is why it's called the diagnosis of exclusion. In Australia, the number is set to double by 2054, and 1 in 10 over 65 are with Alzheimer's disease as of 2024. So, two brain areas that are affected by Alzheimer's disease. Remember the shrunken gray matter? If that's happening in the prefrontal cortex, which is here, right in front, that can affect your spatial orientation. Individual can hallucinate, can have delusions, memory loss, can affect your speech ability, can also have cognitive function affected, and inhibitory control with long-term memory loss. By what that means is someone can start walking when the traffic is still on and the green light is still on. They can't stop, think, and stop themselves from moving forward. And the second area is the hippocampus. If the brain is shrunk in this area, then that can affect the ability to convert short-term memory into long-term cognitive function and spatial navigation. So we can see a few signs in Mr. Smith where he is forgetting things, why he left home, why he can't find his way home, and he's aggressive, has difficulty with sentences, and has been hallucinating. The Diagnostic and Statistical Manual 5th edition has updated the term as major neurocognitive disorder, but the term dementia is still in use. The four characteristics include cognitive function, where one loses the ability to perceive and make appropriate decisions. And you can also have spatial disorientation, where you don't know where you're going, or if you know, you forget. Sometimes individual can get agitated or really become emotional distressed with the fact that you know something's wrong with you, but you can't do anything about it. And there can be some changes in your personality where someone can get agitated and also hallucinate. We can see all these signs in Mr. Smith. Three possible conditions that can cause dementia. One is frontotemporal, where you have the existence of abnormal tau protein along with TDP43. The next one is Lewy body dementia, where you have deposits of protein called alpha-synuclein. The third one is vascular dementia, which causes from damaged blood vessels, or a reduced blood flow of oxygen to the brain. We all have beta amyloid protein, but in Alzheimer's disease, what's happening is this protein over here is being cut from various places. As a result, they are free floating fragments. They accumulate together, which is called as a plaque. This plaque is not soluble in water, interferes with the synaptic transmission. As a result, leads to neurodegeneration. On the other hand, these blue structures over here called as stabilizing tau protein, they stabilize and assist in the functioning of the neurons. They start accumulating together inside the cell. As a result, this accumulating within the cell causes compromise to the neuronal function. As a result, leads to neurodegeneration in Alzheimer's disease. For the messages to transfer from one neuron to the other, we need a neurotransmitter, which is acetylcholine. Now, what's happening is the enzyme acetylcholinesterase is dividing, is cutting this acetylcholine, so there is less acetyl neurotransmitter in the synaptic cleft. As a result, there is less neurotransmission. What we can do is if we inhibit this enzyme, there is more neurotransmitter between the synaptic cleft and more messages passing on. That's how we can help using an acetylcholinesterase inhibitor, which is a donepezil. This will not slow down Alzheimer's disease, but help with the progression. Mr. Smith is on this medication and it will help him improve his attention and perform everyday activities. To be noted, he has got hypertension and he shouldn't be taking beta blockers along with this medication because it can elevate bradycardia. In conclusion, we've discussed about Mr. Smith, two brain regions affected by Alzheimer's disease, four characteristics of dementia, and structural and functional changes, along with one medication, and how all of these are linked back to Mr. Smith. Thank you for joining my presentation. Here is my annotated bibliography.